Have you ever felt a slight twinge or pop in your calf, then all of a sudden you couldn't walk because your calf is killing you in pain?
Oh my God.
Come on.
Most likely you've got a slight tear in there. I'm Dr. Alison Wu, Doctor of Physical Therapy, and today I'll be sharing what you can do during this first week of recovery. Let's look at the anatomy of the gastrocnemius complex. The gastrocnemius muscle is made up of fast-twitch, high-density type 2 fibers which fatigue quickly. It's injured most with explosive, high-speed movements. It's made up of three components: the gastrocnemius muscle, the deeper soleus muscle, and the thinner plantaris muscle. The gastrocnemius is composed of two muscle bellies, a medial head and lateral head. Between the two bellies, the most common injury occurs to the medial or the inner one, way more than the outer. This usually happens when the knee is completely straight and your ankles flexed to the end, with a lengthening tension that occurs with, for example, landing after a jump during basketball, if the leg is planted backwards, straight, and quickly before pushing off. There are three types of tears. First is a stretch injury, second is a partial, and third is a complete rupture. A quick test to check if you have a complete rupture is to lay on your stomach, feet off the edge, feet are relaxed, and have someone squeeze your calf slowly but firmly. If there is a complete rupture, the foot will not move. Typically, when you squeeze the muscle, you will see your foot move with it. This test is called the Thompson squeeze test. If your foot moves, hooray! First, ice that bad boy. Calm it down a little. It's angry and you just tore it. 10 minutes on, 10 minutes off. Do this for a few hours if you can. If it is very swollen and you tested negative on the Thompson test, keep icing for a couple of days and go directly to the taping technique. If not, go ahead and touch it. When the calf is not so spicy and angry, a few days later, or even the same day, touch and see if you can find the place where the slight tear occurred. You'll find a bulbous bump-like location that does not exist on the other calf. So here I drew out the outline of the medial belly, the inner belly, and the outer belly. And typically the tear happens around your medial belly, between the transition of your fascial sheet and the actual muscle belly. So when the calf is not so spicy and angry, touch and see if you can find the place where the slight tear occurred. You'll find a bulbous bump-like location that does not exist on the other calf. Then what you do is take the fibers below the bump and above the bump, dig in kind of deep, and try to shove them together. Take your time, slowly kind of gathering and going towards it. Is pretty painful when you start doing this, so take your time, inching, literally inching towards each other, okay? And then you can slowly get into the bump, and just kind of try to flatten it, okay? Absolutely no circles, no crazy rubbing, because we're trying to conceptually help the fibers overlap, and overlap back together to heal back together. After you do this just a few times, don't do it too many times because it's new and aggravated and rather angry, then we can tape it. All right, so I'm going to take this, measure about here to here, above and below the bump, give it some extra length. Do not cross the knee. Okay, and what I really want to do is draw these fibers together in the taping, a little bit slightly towards the back. So I start below, get it about halfway towards the bump, hold it there, tack it upward and yank the fibers up, and tape it on. Okay, with my foot nice and just relaxed position and wherever it rests naturally. Now the other piece, I'm going to go from about the middle, again similar length. And I'm going to change position to do this. Okay, your foot's nice and relaxed. And again, you're going to follow the belly, follow the fascia. Start below, pull it up, and tack it down. Okay, so now you have one piece right here crossing the actual bump, another piece right here to help support the rest of the calf, especially when you're walking. It's going to be a little wrinkly right now, but as soon as you step on it, this will stretch out. Now, because it is stiff tape, I'm going to put another piece above it. Okay. Just to make sure the top strips don't go away. I'm going to do another piece on the lower. Just to keep the bottom strips engaged. And now when I step on this leg, the fibers are supported. It will feel significantly better each step that you take. It won't be as painful. Give it a few days to keep healing. After 2 to 3 days, take all this off. Do the soft tissue again. And really taking your time, pushing it together. Feel for that bump. Try to flatten it as you're drawing it together and re-tape it up. Keep doing this until when you're walking, there's no more pain without the tape. Leave the tape on for a few days. When removing the tape, use a little oil, put it on top on the corner underneath the sticky part, and add oil as you slowly keep peeling the tape off. And that will be the easiest way to remove the tape without tearing your skin or painfully yanking hairs out. Really, men, women, you might want to shave your legs beforehand. It would make your life a lot easier on taking it off. Repeat above on the soft tissue work every 2-3 days and retape it until you are able to walk around without pain, without the tape. After one partial tear, the risk of developing another one on the same leg is very high. This video by no means replaces seeking a healthcare professional to help you rehab that leg well and prevent future tears. Please see a healthcare professional who has experience doing this, and we will get you back in tip-top shape in no time. Our next video will focus on exercises you can be doing in the first week while this tear is healing. We'd love to hear your feedback and comments below. Let us know what you think of this technique. Hit the subscribe and like button if you want to see more of these kinds of videos, and consider hitting the thanks button and leaving a donation. I'm Dr. Alison Wu, and thanks for tuning in.